In this media, you will learn about fractures and sprains. Signs and symptoms of a fracture are: 1. Pain at the site of the wound that increases with movement. 2. Difficult or impossible to move the affected part. 3. Swelling and bruising of the affected area. 4. Deformity at the affected site. 5. Presence of shock. General first aid to a fracture. 1. Check the DRABC. Danger, response, airway, breathing, and circulation of the victim. 2. Control the bleeding first before immobilizing the fracture. 3. Prevent movements of the fracture sites. 4. Support the fracture with enough padding. 5. Do not push the bones back in. 6. Provide enough padding before shifting the victim to the hospital. 7. Control swelling and pain by applying ice pack to the affected part. 8. Try to prevent shock. Making a splint. 1. The rules of splinting are: A. Stabilize the fracture above and below with your hands.
I'm saying keep on taking screenshots. Like they said, rules of splinting. Stabilize the fracture above and below with your hands. Take a screenshot of this. This will tell you the sequence.
A. Stabilize the fracture above and below with your hands. B. Check motor and sensory functions on the affected limb. C. Immobilize the limb. D. Recheck motor and sensory to be certain you have not splinted too tightly. E. Transport the victim. 2. Ice packs are never applied directly to the skin. This can damage the skin. Always have a cloth between the ice pack and the skin. 3. Prevent shock by having the victim lay down if he can, and keep the victim warm.
Yeah, play this.
In this media, you will learn about bones, joints, and soft tissue injuries. For bones, joints, and soft tissue injuries, the best first aid treatment is ICE method. ICE stands for ice, compression, and bandage and elevation. ICE.
I had said rest, meaning riser. So there
In
is
order
rest
to reduce
added
the temperature of the injured area, it is good to ice the injured area. This helps in the reduction of bleeding in the underlying tissue. There will also be a reduction in pain and swelling. Compression and bandage. If icing is not very effective, the next method to be followed is compressing around the injured area. The pressure from hemorrhage is countered by this method. This also helps in reduction in pain and swelling. When putting bandage, it is necessary to ask the patient regarding its tightness, elevation, and breast. The injured arm or foot should be kept at an elevated level to the height of the heart. This helps in reducing the blood pressure and blood seepage. The patient should take rest for some days based on the type of injury. Thus, you have learned about bones, joints, and soft tissue injuries.
Yeah, play this.
Due to some injuries, if a bone in the hand is broken, then it will show the following symptoms: pain, tenderness, swelling, discoloration, deformity, and inability to move. In such cases, do not move or straighten the hand, and keep it immobile in the same position. Tie a triangular cloth around the neck and the hand as shown in the animation. Then make it quickly to the nearby hospital for further treatment.
Shall we then stop over here and meet at 3 in the afternoon?
Yes, ma'am.
Okay, bye bye.
Thank you, ma'am.
Yeah,
Thank you.
thank you.
Thank you. Thank you, ma'am.